The modified Ashworth scale measures spasticity in patients with lesions of the central nervous system. It is a modified version of the original Ashworth scale, which measures the effects of anti-spasticity drugs on spasticity in multiple sclerosis. The domains of the OT framework this assessment evaluates are body structures and body functions. It is quick and easy to administer and also considered the gold standard for when it comes to testing spasticity. Some common diagnoses and conditions that the modified Ashworth scale is used on is brain injury, cerebral palsy, multiple sclerosis, spinal cord injury, and stroke recovery. The typical age range for this test is children ages 6 to 12 and adult from 18 to 64 years old. The modified Ashworth scale is in English, but there are also other translated versions of the test available. Here are some general guidelines when performing the modified Ashworth test. First, place the patient in a supine position. Some of the tests can also be done on a side lying or sitting position. If the muscle you want to test for spasticity is a primary flexor, start supporting the muscle in a fully flexed position. Inform the client to relax as much as possible. Then quickly move the joint to a position of extension. Hold the position for a count of 1 second. This test can be completed up to 3 times. If the muscle you want to test for spasticity is a primary extensor, start in a maximally extended position while supporting your patient's arm. Then quickly move to a position of maximal flexion. Again, hold for a count of 1 second and repeat the test if necessary. In this next video, I am testing the wrist and elbow on my client. You will see that I go through full extension twice slowly to make sure the muscle is relaxed before on the third attempt I test for muscle spasticity. My client will be supine for the test. The modified Ashworth scale is scored with ranges from 0 to 4. 0 is the lowest score and is recorded when there is no increase in muscle tone. The highest score is 4 and is recorded when the muscle tested is rigid in flexion or extension. It is similar to the Ashworth scale, but adds a 1+ scoring to indicate resistance through less than half of the movement. This is an example of a scoring sheet that you may use. Once you complete the test on the joint you are testing, you can look at the grading scale and record the results. Note that there are not a specific set of muscles that must be tested. The strengths of the modified Ashworth scale are: it is easy to administer, it is quick, usually less than 10 minutes, but depends on the amount of muscles being tested. It is free and there is no training required. However, it is beneficial to be familiar with the muscles. There is also documented validity and reliability in certain populations, but it varies. Another strength to this test is that the only supplies that are needed are a pencil, a piece of paper with your scoring sheet, and a table to perform the test on. The weaknesses of the modified Ashworth scale include the variable inter- and intra-rater reliability. The reliability changes with each diagnosis, such as stroke, TBI, and spinal cord injury, and also the different muscle groups being tested. The inter-reliability for stroke is poor, with ranges from 42.5 to 50%. The intra-reliability, however, was adequate, with ranges from 57.5 to 85%. Another weakness to the modified Ashworth scale is the question of if it truly measures spasticity. Some are also concerned that the grading scale system uses vague wording.